Hey, this is Dr. C again. Hope you're having a good day. Thanks for joining us. Today we're going to talk about long COVID. Now, I know you don't want to hear that term COVID anymore. I know, hell, it's been almost 5 years, but we're going to talk about it. Long COVID. Why? Because I have long COVID. I guess that's probably a reason to talk about it, huh? Let's go over the statistics briefly and then a definition, okay? We always start with that. There's been roughly in the United States over 99 million cases of COVID already, and 1.1 million deaths from COVID. Yes, definitely big numbers. It's predicted that roughly about 18% of those people who have had COVID will come down with long COVID. 18%. That doesn't seem that high, but when you consider the number of people who have had it, it's a good-sized number. So, we need to talk about it. Let's define it. It's a chronic condition of COVID-19. Chronic condition, which means it's been there a while. So it's an infection that lasts longer than 3 months. Now, there's been some problems along the way. And I got to admit, I've seen it, the problems. Number one, the medical community didn't really recognize long COVID until more recently in the last year or so. Why was that important? Because a lot of the people who have long COVID have disabling symptoms. Really disabling symptoms. They couldn't work. Some applied for disability, Social Security disability, and got rejected because it wasn't a diagnosis. Can you believe that? So what did they do? They said, well, what's going on? Well, it takes a year. You have to have those symptoms and disability for a year before Social Security will even consider you. And then it takes 5 to 6 months before you finally get yourself a check. Now, that was one of the biggest impediments. Finally, COVID got its name. Long COVID was approved as a symptom, as a disease. But unfortunately, there's no test for long COVID, no proof, objective proof like a test, no treatment either. So tell me a little bit about long COVID. Well, it involves over 200 different symptoms, over 200. That doesn't mean I have all 200 symptoms. Heck, no. No. All you need is 1 or 2 symptoms. You got it. Period. But there's over 200 different symptoms that you can have in different systems in your body. So let's go over the individual symptoms. The most common symptom is fatigue. And I can really vouch for that fatigue. I'm wiped out. I wake up wiped out. I go to bed wiped out. That's not me. That's not me. I fight to do exercises and things like that. I force myself to do it because exercise is good for you. Let's face it, it's good for you. But it poops the heck out of me. It really does. So, fatigue, number one symptom. 80% of people with long COVID have that fatigue symptom. That's sort of a general, a general symptom. Another general symptom is that the fatigue gets worse with activity. So if I walk up a little hill, I'm pooped. I'm breathless. That's another general symptom. Brain fog. Now that took a long time before they eventually did give a diagnosis for brain fog. And it still is in the talking stages. And we'll talk a little bit about that. I had brain fog for a while myself, too. So those are the kind of the general symptoms that you can get from COVID. You can get worse symptoms, obviously, all the way to organ damage, all the way to people who have organ damage that leads to their death. But let's talk about the individual systems first. Okay, some people think that long COVID is a neurologic symptom, a brain and spinal cord and peripheral nerve symptom. And they have a lot of evidence that would support that. For example, I have loss of taste and smell. I lost it back in the end of last December when I had my first bout of COVID. That was almost 7 months ago, and I still can't taste a thing. I'm beginning to get a little smell, but not much. That is a real pain, a real pain. You got to force yourself to eat because you can't taste a damn thing. So that's number one. Number one. Some people will get difficulty with their eyes, with their vision. They'll get blurry vision from time to time. No explanation. Some people will have chronic headaches, usually frontal. No explanation. Some people get postural dizziness. In other words, when you're lying down and you sit up suddenly, or when you're sitting, you stand up suddenly, you get a little bit wobbly. That is postural. That's a postural symptom. Some people get insomnia, can't sleep well. Some get depression, anxiety over the fact that you've got this damn disease and you can't do anything about it. Some people will have cognitive problems, like, for example, executive function. They have trouble concentrating, focusing, putting it all together and doing an action based on that knowledge. Executive function. So cognitive ability in some people have gone down. So those are all brain and neurologic symptoms that you can get. The next system is heart, cardiac symptoms. You can get palpitations, irregular heartbeat, usually a tachycardia, a fast heartbeat that may come and go. You may also get chest pains across the anterior chest, thinking, my God, I've got a heart attack. So those are all related to heart. The kids get their own form of myocarditis, an inflammation in the heart muscle. Fortunately, the kids, very few of them get it, but the ones who do, it is disabling. It's disabling. So those are some of the cardiac symptoms. You can also, part of the cardiac would be the micro blood clots, little clots. And that can lead to possibly some of that brain fog if the clots go up to the brain. They can go downstream as well. They can cause trouble with your fingers, with your toes, with your legs and arms. Fortunately, it's not common, but it can happen. So those are all cardiac related. People have gotten a stroke from the blood clot. Okay, what else? Lungs. Now, we always thought about COVID as a respiratory disease, and so the respiratory symptoms are significant, especially when you have acute COVID. But what about later? What about the long COVID respiratory symptoms? Chronic cough, number one. Chronic cough. Number two, shortness of breath. Shortness of breath, especially when you're trying to do any type of activity. Chest pains, as I mentioned, and you can get symptoms related to those clots, blood clots as well. Those are all respiratory or pulmonary, you might call it, symptoms. What others? You can get digestive tract. You can get nausea, vomiting, diarrhea, because most likely there's a change in the gut microbiome. We've had a talk about the microbiome, and probably we need to have another one because it's becoming increasingly dealt with in the laboratory now, the gut microbiome. You can get muscle pain and joint pains and muscle aches. I myself have back pain. Now, I should not have back pain. I have exercised all my life. I have never had an injury to my back. I am very careful about my back. I do have some chronic, I guess you might call it a chronic arthritis now that occurs in some of my joints and in the low back, but it's magnified by the long COVID. I wake up with back pain every day, and that is an entity. So, these are all part of the joint and muscle symptoms. You can also have some metabolic symptoms, increased type 2 diabetes, for example. Some people get an elevation of their cholesterol. Question of how and why, all related to long COVID. So those systems, all those systems are all tied in to long COVID. So what are the major issues involved now with long COVID? Well, I mentioned right at the beginning that even the medical personnel were very skeptical about the existence of long COVID. And if you tell them these symptoms, they're symptoms of many other diseases, yes. But they don't think about it in terms of long COVID. They think about it in terms of the respiratory or the pulmonary or the cardiac symptom. They don't even think about long COVID. So there's still a lot of skepticism out there about the existence and the scope of long COVID. Also, long COVID is similar in many ways to several chronic illnesses that are out there. For example, like chronic fatigue syndrome, like what's called myalgic encephalitis, which is the brain fog, fibromyalgia. All these chronic illnesses are very similar to the ones that have long COVID. Another thing about this brain fog thing, too, that diagnosis of brain fog, the definition basically now is that it's a significant, persistent neurocognitive impairment, such as processing information, like I said, inability to focus, inability to concentrate, inability to pay attention. All those things are related to that, quote, brain fog. What other problems are there? Well, if chronic fatigue, loss of energy, no energy. And the worst thing about it is that we're not sure why it happens. Not sure why. And remember, it gets worse with exercise. I get pooped out with exercise. What are some of the risk factors, I guess? Who's getting long COVID? Well, there's no question that long COVID is worse, or at least more existent, in people who have had serious acute COVID, especially those who were hospitalized and maybe even had to go on a ventilator. They have a greater incidence of long COVID. But you don't have to be. You don't have to be at all. What else puts you in the risk factor? Women get it more than men. I don't know why. Nobody knows why. But women get it more than men. Sometimes you see studies that show that, well, people who are Hispanic tend to get it more than non-Hispanic. Well, okay. I'm not sure how valid that is, but that is being written about as well. Certainly age is a big factor in a risk factor in getting COVID. Age, especially age over 60. Again, why? Why? Well, they keep saying that people who are older have more chronic illnesses, which makes them a little more susceptible, maybe more immunosuppressed. So they would get, most likely, long COVID. So those are all the risk factors of long COVID. People who have never been vaccinated against COVID tend to get it more as well. Right now, almost 80% of people in the United States have had COVID or have been vaccinated, or both had COVID and vaccination against COVID. 80%, well, 80%, my gosh, you should have that immunity from that. Herd immunity, they called it, herd immunity. Well, the people who really believed in herd immunity, they knew ahead of time that it was mostly the elderly that were dying. They didn't care about that. Let's get the herd immunity. Let the old people die off. Well, okay. I don't think I need to go into that anymore. Plenty of ageism out there, let's face it. What are the reasons why we get long COVID? Finally, after people finally accept, well, the people who have the money and the experience finally came to the realization that long COVID is a real thing. Let's put some money into it. Let's look into it. Let's find out what the common denominator is why people are getting long COVID. So there are theories, and that's all they are theories. Number one, they think that maybe it's because of the COVID virus that initially caused the infection is still able to hide in your body. And so it can re-exacerbate in time. The proof of that is that they have cultured out the COVID virus up to 2 years after you've had the acute bout. And that's not in a lot of people, but it is enough to make it a theory as to why you may get this long COVID. Number two, they think that it's due to a dysfunctional inflammation process in your body. Now, that whole aspect of inflammation has to do with your whole immune system as well. And again, we've had a talk on the immune system in our bodies as well. Some think that you get an abnormal reaction in some people with increasing chemicals that keep your symptoms going. That's theory number 2. Number 3, a big change in the gut microbiome. Now again, that's a little tougher to prove. They have shown a difference in the microbiome in people who have had long COVID versus the people who do not. Is that the reason? No, but it's a theory. It's a theory. The final theory is that it's due to a mitochondrial dysfunction. The mitochondria are basically the little energy packs in our cells. Why would it dysfunction? What did the virus do to it to make it dysfunction? And why in only 18% of people who get it? Don't know. It's a theory. So those are the theories that are at least out there to try to explain it. Now let me just briefly talk a little bit about people who are anti-vaxxers. People who think that if you get vaccinated against COVID, you're going to get COVID, you're going to get some of these terrible symptoms. Well, what are the risks of getting the vaccines? Number 1, you can get some neurologic symptoms like headaches. In fact, headache is probably the most common major symptom that you can get. Everybody gets a little soreness in their arm, may even get a little brain fog. But nevertheless, what are some of the other risk factors of getting these vaccines? Well, we know too that some people, after they get their vaccine, get a reduction in the number of platelets all of a sudden. And so, why does that happen? Where do the platelets go? They go into little micro clots. Takes the platelets, they get off and plug up a vessel somewhere. It can even cause a stroke. There have been strokes in people who have gotten the vaccine. Not many, but there have been. You can get what's called a Guillain-Barré syndrome, which is a myelitis, a transverse myelitis in the spinal cord. That has happened. And it's not just with the COVID vaccine, it's happened with other vaccines in the past as well. That's one of the reasons why they have to go through each step in approving a vaccine. So, Guillain-Barré. Bell's palsy. Now that, remember I told you about what I have, the loss of taste and smell. Well, if you get that, those are 2 of the cranial nerves, taste and smell. There's also a cranial nerve for the facial muscles. Now, if that one is involved, it can cause a Bell's palsy. So if you're weak on that one side where you get the Bell's palsy, all of a sudden, you're over to one side. You're dribbling. That is a Bell's palsy. Fortunately, the ones who get it from the vaccines, it's temporary. It does come back. But while you got it, it's a real pain. People have gotten some seizures from the vaccines as well. People can suddenly get a high temperature, hyperthermia. Again, not very common, but it can occur. Now remember the old shingles. Remember the shingles virus lives in you. If you've had chicken pox, you've got the virus living in you. Well, that vaccine can stimulate then an outbreak of shingles in you, just like it can possibly stimulate an onset of the Barr-Epstein virus. That's the one that causes mononucleosis. So all these viruses, the herpes virus for the Barr-Epstein, all these viruses may actually be latent in your body, and when you get your vaccination against the COVID, you activate your inflammatory system, which then rekindles the old shingles or Barr-Epstein or whatever. So all those things are the risks of the vaccine itself. Again, fortunately, when we're putting them all together, the number of serious major side effects is 1 to 2% of the people. That's it, 1 to 2%. So that in a nutshell is long COVID. We do not have a treatment for long COVID. The doctors treat the individual systems and symptoms that you have. But again, no one knows yet why we get long COVID. So here I am 7 months into it, and probably no further along than I was right at the beginning. And I'm very hopeful that I'm going to get back everything like it was before, but you don't know. And what you don't know is the thing that bothers you the most, just being ignorant of what is causing it in the first place. So this Dr. C, I hope you stay away from COVID. Remember, don't give away that mask yet. Have a good day.